Good evening, everybody, and welcome to this incredible edition of An Hour with QENDO. Before we get going, I would like to pay acknowledgement and tribute to our Aboriginal and Torres Strait Islander people. For any of those that are joining us in online or in person, we pay our respects to elders past, present, and emerging. And, I'm in Toowoomba, so I'm on the land of Jarrawa and Guyabal peoples. So I'm very grateful for their land. It is absolutely incredible out here outside of Toowoomba. And joining us tonight for our acupuncture and Chinese medicine chat is Dr. Ash Gordon. Now I'm going to read his bio because it's really cool and I don't want to get anything wrong. So, formerly from Melbourne, Dr. Ash is an acupuncturist and Chinese herbalist with 15 years. Yep, 15 years of
Yeah.
clinical experience behind him. Ash has worked alongside leading practitioners in the field and continues to establish his place in leading and a leading practitioner in Brisbane and Australia. Ash has a passion for Japanese acupuncture and recently graduated from the Institute of Classical East Asian Medicine, practicing classical Chinese herbal medicine. In addition to being an esteemed acupuncturist, Ash is a qualified bone therapist and seamlessly integrates this therapy in his acupuncture treatments. So, along with his love for Japanese acupuncture, Ash incorporates different elements into his treatments depending on each person and each of their presentations. So, thank you, Dr. Ash, for joining us. It is such a lovely and a pleasure for you to be online with us tonight. For everyone listening in, we've got the Q&A function and the chat function available. So if you have any questions or comments you'd like to answer, as I'll have answered as we go through, just put them in the chat function and we will get to them at the end. So that is enough from me. Enough of Ash Webb. Let's bring in Dr. Ash Gordon and let's take it away.
Thank you, Ash. I really appreciate it. And thank you to everyone for having me here tonight. It's um it's a matter that's quite close to my heart. I work in the space of women's health and fertility. So endo and adeno and any kind of menstrual health is a really big part of what we do. And so we see these conditions a lot. And so it's a big part of what we do. So to be a part of this tonight with Quendo, I love it. So thank you very much. Now, I can't see anybody on the screen here, and I know that there's people there, so thank you. Um,
Ash, do you want me to have my face so it looks like you're presenting to someone?
oh, that'd be great. I'd love that.
Yeah, all right, I can do that. I can do that. I'll turn my mic off though because I'll sit here and go and
Great. Wonderful. That sounds good. That sounds good. Thank you. So, without knowing how many of you guys have had acupuncture or Chinese herbal medicine before, I'm going to start with the basics and we're going to go right back to the start. And the the best way that I can explain the benefits of what acupuncture does in Chinese herbal medicine, because effectively they're the different techniques, but they're all about going towards the same thing. So it comes down to blood quality. So if you think about, I was thinking about this before, and the main way that I can explain this in terms of how we increase blood quality is if you look at slow blood, and if blood is not moving, which is what we call stagnant blood in Chinese medicine. Think of a creek that has mud in the creek and the mud's not moving and it's obstructing and it's getting in the way. And the way that we get that mud out of the creek is we send water down that creek. It picks up the dirt, picks up the stagnation of blood in what we're talking about in the blood vessels and carries it away. So when we look at how acupuncture and Chinese medicine approaches endometriosis and many kinds of female health scenarios is by picking up slow or blocked blood and moving that. In our world, if there's slow blood, that's what gives rise to pain. So endometriosis is kind of the epitome of a blood stagnation scenario. It's the epitome of it's kind of how I explain it to patients at work. I'm like, well, have you heard of endometriosis? And 99% of people have said yes. And when you've got slow or blocked blood, that's when pain turns up in our world. So our goal is to move all of that. Not only is it about moving block blood, which can give rise to inflammation. It's also about dealing with the nervous system response and how the nervous system views pain. So there's two things that are very, very big in the world of acupuncture and herbal medicine and how we treat endometriosis and adenomyosis and any kind of, you could really say any kind of period pain, because it's the same thing for us in our world. It's it's kind of like this really um, basic model of what's going on, and it really comes down to one aspect, and that's moving and clearing blood and making sure there is really good quality blood, because that means that it has all the components of healthy and fresh blood, and it's not old, it's not depleted of its iron stores, it's not depleted of its white blood cells, it's not depleted of its platelets. So good quality blood is the name of our game. And yes, it comes down to one thing and one thing only, but it's how we get there is that's the complex one. We we view every single body as a completely different setup and a different system. There's not one, two people the same. It's a the Chinese medicine textbooks are going to probably call me wrong here, but the saying similar to eight symptoms or one symptom and eight different ways of addressing it, and vice versa as well. So we we have to diagnose specifically to the individual, and we have to figure out the way of treating that body based on our diagnosis system. So it's a complex scenario, but we do come down to the one concept of blood. So it's really, really good. So I love it. I'm biased. I've been doing this for 15 years. I was a teacher for 5 years, and then decided that I wanted to do something else. Not that teaching was bad, it just wasn't my jam. And then went back to uni at 28, and then found my first day at uni was just a mind-blowing scenario. So we just kept going, and here we are. Today's my day off, so Thursday is a study day, and I'll never stop studying and never stop learning, because this is a field that rabbit hole is so, so deep. So it's wonderful. So I have a few notes here, so excuse me. So as I said, I practice Japanese acupuncture. It's a lot of people don't know about Japanese acupuncture, and there's a lot of practitioners that don't know about acupuncture. I didn't know about Japanese acupuncture until my wife and I moved from Melbourne 5 years ago, and I got a job up here, and my old boss is an incredibly skilled Japanese acupuncturist. So I observed him for my first day of work and was just completely flabbergasted by the immediate effect that it had. So the way Japanese acupuncture works is that we effectively treat what we make. So how the body presents in that moment, in that real time space, that's what we do. You could present different in the morning versus different in the afternoon. So what we do is we address whatever the body is telling us to do at the time. So it has nothing to do with us figuring anything out. It's about what the body says, and we're completely led by the body. So we use what we call Hara diagnosis. Tummy shouldn't be the right word. Stomach diagnosis, which is called Hara diagnosis. And we have a feel around your stomach, and there's some tender points that tells me which pattern you're in from a constitutional level. So it's all coming back to where your body's at, what it needs the most to be able to regulate blood and energy around the body, so that optimal health is gained and less pain is felt, as well as calming down the central nervous system, which are the two biggest things for endometriosis. So that's the main difference between Chinese and Japanese acupuncture. Japanese acupuncture generally is a lot more gentle, and it's a lot more subtle in our needle technique. There is, I think one of my favorite things is someone comes in and asks the question of, does it hurt? Or they're scared of needles. I find it as a mini challenge, and I'm always up to the task to allow them to then, after you put the first needle in, their response is, "Oh, is that all?" So I really enjoy it. It's good. So it's a lot more gentle. It's a lot more subtle. It's very individualized to the person at that time, and very calming. Calming the mind is one of the greatest skills that acupuncture has. So if we can get our mind out of the way, the body knows exactly what to do. And so that's one of the key parts of Chinese medicine is we call the mind the Shen. So Shen calming is a very important part and it works perfectly. So a lot of people fall asleep on the table. You don't have to, but often people do. And they have a deep sleep and they come out of it and it's what we call an acu nap. And then they come back again because they want more. So it's really good. So that was the main differences between Chinese and Japanese. And if you guys have any questions, please pop them up in the chat. I'm not sure actually if there's anything I need to do to see that chat because I can't see anything at the moment. Um,
Does it
but
pop
let
up
me
at the
know.
bottom of the screen at all for you?
No, I could be in the wrong view though.
That's
Actually, hang
okay.
on, let
If
me.
there's any that come up, I can read them to you.
Okay.
I
Oh, there we
have
go. I've just got
I
it here now.
You got it, cool.
Yeah. Okay.
But if I jump in, sorry, to understand the difference between Japanese and Chinese, just to really confirm that,
Yep.
is that Japanese is a softer technique, Chinese is a bit of a harder technique. Is that kind of, have I got that right?
Yeah, you could definitely narrow it down to that. I wouldn't say harder. Harder might be a different word because every practitioner has their own needle technique. Um,
Mm-hmm.
it's more based on the fact that the needles that we use in Japanese acupuncture are generally thinner, and so that gives less of a skin sensation when the needle goes in. And also we are quite superficial with our needle insertion, which means that if anybody's ever had dry needling and they put the needle in and they get that nerve response, which is what they need to do, and they're great when they do it properly. Um, that's not what Japanese is about. So we're very much you put the needle in and then you just let the body do its wonderful work. So that's kind of our theory. Yeah. Um, so it's the stomach diagnosis and the needle technique that's generally the main thing or the main differences between the two. Um, the other aspect that we work with a lot is Chinese herbal medicine. And so Chinese herbal medicine is a wonderful it's a wonderful modality to take part in alongside acupuncture. Reason being is they're from the same medicine. They're both working towards the same regulation effect with your blood and your. So in our word we call chi, but it's let's just talk about blood. That makes a whole lot more sense. So increasing blood flow to the organs that need it. So namely all the gynae organs, and the surrounding muscles around your pelvic cavity. So sending fresh blood to that area is key to being able to help the symptoms of diagnosis. Sorry, help the symptoms of endometriosis. And it's not only just helping getting blood to that area to relax the contracted tissues that are causing the pain. It's also to help regulate your hormones, which is obviously another huge part about it. But then you've got within those hormones, you've got these axes that are linking to your brain and to your ovaries and to everything else down there. So calming down that feedback loop is really important as well. And by sending blood to the area, that's the way that we do it within the realms of acupuncture and Chinese herbal medicine. Chinese herbal medicine, I feel, is almost designed for women because you guys have, sorry if there's guys on here as well, I apologize. But yeah, for the women, because you have a uterus, and I feel like Chinese herbal medicine is designed for the systems that include a uterus. There's some herbs there that are just incredible to help blood flow and to help blood regulation. So I feel like when a female does jump on board with herbal medicine, I get excited because I feel that we're going to make some tracks pretty fast. Um, Reproduction in guys was, I think, 6 weeks out of our 2 year subject at university, and the rest was female. So our plumbing is simple and doesn't require any nowhere near the complexity that understanding the female's body does. So it is a very obvious thing that guys, we're pretty straightforward, but girls, that's why I feel like it's just designed for the female body. It makes a lot more sense when you're learning it to apply it to a female body. So
That's a
it's
really good point, Ash. And like, as I think about it, I was like, we're stepping into an age where we have, transgender people as well, and
Mhm.
that sort of thing. Like, I'm so interested to see how, because we refer to a lot of women and female assigned female at birth and
Yep.
all that sort of stuff. So, very very aware that we have trans people among us in the endo
Mhm.
space.
Mhm.
And I'm really interested to know, like, if you have, someone, I'm so off script. I'm so sorry.
No, please
If
be.
you have, someone who I guess, doesn't identify as female, like, does
Mhm.
that help, like, do you change your treatments based on whether or not, even if they might still have their uterus,
Yep.
like obviously different, I guess how, yeah, how do you kind of navigate that?
Yeah, really, really good question, and I'm glad you asked that because that's a really important one. Because the way I would explain that is that if there's a body on the table, the body is a body. So it's not part of our medicine to treat anything else except for the body. So you could literally, I know this sounds terrible, but you could put a pillowcase on someone's face and we'd had no idea what it is. The body is there. So I use the tummy, whatever the HARA diagnosis tells me, that's what I need to do. That's what the body's requiring from me to do. We feel your pulse, and your pulse again tells us where you're at constitutionally and which organs need to be addressed, which ones need to be boosted, which one needs to be calmed down a little bit for want of a better term. And the way we do that is via blood flow. So it's a matter of treating the body and the way that that presents. And it's about regulating the homeostasis of the body. And so when we're looking at a heterosexual body versus a homosexual body or a trans body, it's more about, okay, what's your body telling me and how does it want to be taken to its happy place? So that's what we need to do. So I'm not sure if that answers the question adequately. Um,
It absolutely, absolutely does. And we've had a fantastic question come in the Q&A to sort of
great.
top that off. How does testosterone affect female plumbing? So if we're talking, like sometimes we've got our PCOS friends
Yep.
that,
Yep.
have that, but also,
Mhm.
our transitioning friends too. Like, how does testosterone affect that?
Testosterone, because when we're looking at it, I suppose then what's interesting about Chinese medicine is that 5,000 years ago, testosterone didn't, they had no idea what testosterone was. So it's more the modern day application of specific hormones and 5,000 years ago, all they knew was, okay, what comes out of the body? And so what comes out of the body would be blood, it would be your stools, it'll be urine. They're the main ones. So that's how they would look at it. Modern day application, we know so much more, obviously. And so when we're looking at regulating hormones, we're not looking at regulating one, we're looking at regulating all of them. So it would be regulating your body's happy balance of testosterone, estrogen, progesterone, luteinizing hormone, all of them. So you kind of can't regulate one without regulating the other. So when we're using acupuncture and using herbal medicine, so I'll put it in a scenario with women. We do a lot of basal body temperature charting. So that's how we know what the hormones are doing relative to the menstrual cycle. Then we can see which hormones are the ones that aren't playing ball and which hormones are the ones that are potentially causing the other ones to be out of whack. So by doing acupuncture and doing herbal medicine, what that's doing is regulating the entire gamut of hormones and making sure that they know how to play ball and there's a happy ovulation. That's what we're looking at. So when we look at testosterone specifically, it's absolutely affecting testosterone. But the only thing I can say relative to that is it's regulating testosterone based on the fact that it's regulating the body and the other hormones together. So again, I don't know if that answers that question. If it does, thank you. It's saying it's this scenario where there's lots of complexities going on, but at the end of the day, acupuncture comes down to regulating blood and all of its components together. So we need to put a magnifying glass on the hormones, which is what basal body temperature charting does for us. And it really, truly is the magnifying glass, one of the only ways that we can, because you're not going to get blood tests every week. So we take these temperatures and we're trained in to be able to read these charts. We use an app called Fertility Friend, which is fantastic. And that tells us everything that we need to know. So we look at that and go, okay, is there an estrogen problem here? Is there a progesterone problem here? And so the main impactor with testosterone would be when you're in a stressed state and there's cortisol running around your body and you're in fight or flight and you're in survival mode, it literally cuts off sex hormone production. And so in my understanding, I the body cannot do both at the same time, or it really struggles to do both. So when you're in that stressed survival, go, go, go adrenal state space, your sex hormones just really aren't going to play ball properly. So that's another thing why central nervous system regulation and calming down the central nervous system, which a lot of it has to do with your mind and making sure that we're not overthinking. So to get that calmed down and get that into a space of regulation, I suppose, means that the sex hormones can do their job. So that's when testosterone would come into play and building up those hormones because you're no longer in this fight or flight state. Is that okay? Did that
That
do,
that's
did that do the
that's
trick?
perfect. I think
Good.
that's we have a comment that was like that was answered wonderfully, so that's really good.
Thank
Um,
you. I'm
I,
glad you've enjoyed
yeah,
it.
we have a lot of questions on how different hormone levels interact with different, and if you're going back to that flight or fight,
Mhm.
when you're like, obviously, do you see a lot of patients that are currently stuck, in that flight or fight, like they're not? And I'm really bad at like that whole nervous system reset
Mhm.
and things like that is, Chinese medicine and things like that. Is that sort of help along that way as well?
100%. It's the modern day affliction. He's being in this adrenal space and this is why I love Japanese acupuncture because it has the ability to be able to specifically tell me when you're in this space. And so I know that when you're in this space, you could flare into this because you've had a poor night's sleep and you don't have petrol in the tank. So your adrenals and your adrenaline has to get you through the next day. So if I see you at 5 o'clock on that day, you're still going to be in this space and your body's going to be exhausted. So if you're in that space once and we're able to pull you out of it and your body knows how to get out of that space, fantastic. Probably 8 times out of 10, when there's a new body on the table, they're in that space. They're in that adrenal space. And specifically women are in that space, especially if there's been children involved and they're a mum and it's just 1,000 miles an hour. There's no downtime. And so to get on the table and to be able to work with a female's body that is in that state is a gift because my goal is to get them out of that space. And so to get them out of that space and then the body in 1 week is there or the first however many weeks is there and then it'll get to the point where it moves out of that space and goes to another pattern. And I get really excited. I'm like, good, we're there. Okay, we've passed the first mountain. We're now into that deep blood regulation, which will affect the hormones and they're no longer living in that fight or flight state. They're no longer in survival mode, and their body knows how to heal. And that's what I love. That's one of the great parts about it. And
That's
so
so
yeah,
good. I'm not gonna. Got no questions, so you want to keep on with what
yeah,
you
yeah, yeah, totally.
you have.
And
Sorry to keep interrupting, but
no, no,
yep,
no, 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 go for it. it's
Yeah.
given me more things to talk about, and I can
Talk underwater.
take
I
it
love
forever,
it.
yeah, when it comes to this. Um, but the other thing I will say about being in that survival mode and being in that fight or flight space is that 10 out of 10 times, and I'm not even going to say 9 out of 10, I'll say 10 out of 10 times, it's going to affect your sleep. If it affects your sleep, that means that you're not going deep enough in your sleep. And if you're not going deep enough in your sleep, you can't kick into that parasympathetic space and your body can't hit the rest digest repair. If it can't hit the rest digest repair, then you're effectively sleeping at surface level, you're not going deep enough. And if you're not in this realm, then the the certain organs can't do their job. They can't replace the blood as much. They can't fill your petrol tank, so you can wake up tired. Sometimes, if people are waking up between the 1 and 3, the very common time, if you wake up, roll over, go back to sleep, that's okay. If you need to go to the toilet, that's okay. If you're lying there for half an hour or so, then that's when we need to look at regulating that because you're just not getting the sleep that you need. So that is a huge focus of Japanese acupuncture is regulating your sleep. It's kind of like the most primary mechanism that needs to be regulated first. Because if that's not happening, there's a lot of things that aren't happening as well. So we've got to get that. We've got to get that sorted. And that also comes down to the down regulation of the nervous system, which is the sleep is the biggest focus in Japanese acupuncture, and then that then flows on to that aspect as well of down regulating that nervous system. And when that happens, good things start happening in the body as well. And so enabling the person on the table to trust that their body knows what it's doing. And often people have been in that space for a very, very, very long time and they just keep pushing and pushing and pushing and pushing. And there's medications and there's this and there's that. And they're just, they're crutches, they're supporting it and often not doing a great job. So we want to get trust back in the body that it knows how to do its job properly, and that hopefully a lot of those medications can walk away. That's the goal. And then people take a breath and they no longer think about their pain. They no longer have to worry about taking a day off work because they need to be in bed all day. There's lots of pros. And when someone tells me that they've had a lifestyle shift because of the benefits that they've felt from acupuncture and herbal medicine, it's got to be one of the greatest perks of the job, you know. That and working in fertility and then someone having a baby, that's also fantastic. So, but there's lots of pros. So, yeah, that one. Now, I'm not sure who's had acupuncture and who hasn't, but the when we're looking at what happens in an acupuncture treatment, and this is on my old website, I used to have an FAQ section, and the first question was what happens in an acupuncture treatment? And it was a great question to have answered because it gets rid of one of the biggest question marks that people have about coming in for an acupuncture session. And people are just like, you have to take all your clothes off, and do you have to do this, and do you have to lie there and meditate? And no, none of that. So you come in and then you'll talk to your practitioner, and your practitioner will hopefully have your intake form there, and they'll be able to. The good thing about an intake form is that it means we ask less questions. And so it's all written there. So we have already gone through that and we find out what it is we want to know more about. And with a female, often it's to do with their menstrual cycle and if there's any symptoms going on there, because that tells us a huge amount about what's going on in the body. And so you come in and you'll talk, and then they'll feel your pulse and they'll probably check your tongue as well. It's a big part of Chinese medicine diagnosis. Your tongue is a direct relation or a direct representation, I should say, sorry, of your digestive system or what's going on internally. So your tongue tells us heaps. We can take a snapshot of your tongue and we can have a really good idea of what's going on internally. So if you have to if you're asked to stick out your tongue, it's purely to match up what you're saying to then match up to your pulses to then. It's not a huge part of Japanese acupuncture, but it's a huge part of Chinese acupuncture and Chinese medicine as a whole. So for me, it's just another tool in the toolkit, to be able to use all of these different things. It's great to have more than just the one stream. And so they'll diagnose you using these different techniques. They'll find out where you're at and what your body needs to be able to get back to balance again. You jump on the table and then you'll be introduced to acupuncture and how that feels. And hopefully you'll be pleasantly surprised with how little discomfort you feel. And then you'll have the needles go in, and then you'll be lying there depending on how long the treatment time is, but you'll be lying there for 20, 25 minutes and sometimes 30 minutes. And in our clinic, we have headphones. And so you have headphones put on and the body generally goes deep, and so you don't have to fall asleep, but often people do. And they get some really good quality sleep. I don't know how many of you have a Whoop or an Aura Ring or a Garmin or something like that, but often people, yeah, but often people will then be able to track their relaxation and their sleep. And I had a friend of mine, and he sent me a photo of his Whoop, and it said that he said, how was, I think the Whoop said something like, how was your power nap for 25 minutes between 4:30 and 5? And so he changed it and he called it an AccuNap. And so every time he has one of those, his Whoop tells him that he's had an AccuNap. So the relaxation level that you go to on the table is brilliant. And what that's actually doing is setting your body up so that when you go to sleep at nighttime, it knows how to do it. So the beauty of acupuncture is that every time you go to sleep at nighttime, the body is kicking into this. We know how to do this. We know how to go deep. We know how to repair. So it's just this consistent thing. And from a hormone regulation point of view, weekly treatments is where the evidence lies to be able to regulate hormones as quickly as possible. And when you do it, when someone comes in that frequently, the the changes in the body are quite fast, especially when there's herbal medicine involved, but also the speed in which we're feeling changes in the body from a Hara diagnosis or with your pulse or your tongue or your symptoms, whatever it is, we're always impressed because when someone's consistent and does the homework, as in coming to the treatments and taking their herbs and making whatever lifestyle changes need to be made, then we see really, really good results, which is wonderful. So it's a team effort, 100%, every single day of the week. So it's not what we do, it's what everyone does. So it's good.
I have
So,
a thought, a
yeah.
question.
No.
As someone who has seen, I guess they call them alternative therapists, right? Like that's
Mm,
not the standard Western medicine.
mm.
Can you tell if people have followed through with their taking of their herbs, of their tablets? Because I've always wanted that. Like I saw a clinician, in my early days of my endo diagnosis, and I hated the
Mm.
taste of the stuff, so I never
Yeah.
took it. And it'd be interesting to know whether you as a practitioner, it's different when you go see a pelvic floor physio. They know if you've done your exercises. If
Correct.
people don't take the herbs or whatever it is,
Mm.
obviously as a practitioner, you'd have some form of understanding whether or not they've followed through with the plan.
Yeah, absolutely. It's pretty easy with herbs because they're a physical thing. So if we give 2 weeks worth of herbs and we know in 2 weeks you're due for another bag, they're like, oh no, I've still got some left. You can give them an extra week because it does depend on the size of the teaspoon. So if they're not doing a full teaspoon, they're going to have longer. Um, so in that respect, that's pretty obvious. There's some people that after 4 weeks are like, no, no, I'm still going. And like, okay, well, we ask people to take herbs twice a day. So they may only just doing the one on, and then some people can come clean and say, I'm really only hitting once a day. I'm like, okay, that's great. Thank you for telling me. Like, honesty is absolutely the best policy because then we can work within the realms of what's going on there. No one's going to get a slap over the wrist. You do the best job you can. And so,
And two, it's only supposed to help. you, right? So if you don't take
Correct.
it, you know, and
Yes.
advise, like that
Yeah.
was always what was in the back of my mind. I was like, they've told me I need to take it. I should take it this, you know, hopefully it's going to help. But whatever it was, I don't remember. It was so long ago. It
Yeah.
just tasted horrible. So I was like, no.
And that's got to be the greatest deterrent is the taste. And so we're extremely upfront about the taste, and we'll always say that they're pretty horrid. Um, it's a definitely then we pitch it as a short-term loss for a long-term gain, which it is
Mm.
100%. And at the end of the day, you block your nose, you put as much water in as you need to be able to get it down. Herbs don't work unless they're in. For me personally, I I have a huge glass. I have a lot of liquid in there, which my boss thinks is just absolutely wild because she has about that much. And
Oh,
so, but to me, that's brutally intense, and I cannot handle that. I'd rather have a lot of water, less taste. Yes, I can skull fluid, so it's not a problem for me.
there.
But if you,
Yeah,
yeah.
cool.
So everybody has their own way, and they don't work unless they're inside. So you take them whatever way you need to do it. But yeah, so we can tell with the physical bag when they're due for herbs, if they've still got some left, then they're not being as diligent as they should. But also if we're not getting the results that we're after. So for instance, if we kind of have a good gauge on how quickly symptoms should move, and yes, everybody is individual and everybody's body responds differently to the treatments. And the body will absolutely choose which symptom it wants to change first. There's no rule book. It'll do whatever it wants to do. Not necessarily the easiest thing. And not necessarily the biggest priority. It'll just change whatever symptom it needs to. So if a woman's coming in for menstrual regulation, and unfortunately with that, often it can be the once a month thing. So you do have to wait a bit of time. But there's generally still some symptoms that'll go on during the cycle. So whether it's ovulation or in the luteal phase or the follicular phase, whatever it is. And that's where basal body temperature for us is a big thing because we can see where the temperatures are at and we can see where they're at right now, where they should be. And by knowing the treatments that they've had and the herbs that they've taken, we can have a pretty good idea of what that should look like. So by feeling the pulse, that's probably the best way we can see whether they've been taking them or not. And looking at the tongue, because it tells us the digestive system, and if they've got a lot of, like if their metabolism is slow, or they've got a lot of what we call damp in the body, or if there's a lot of heat in the body and they're obstructing the course of blood. So we can see if they're still present in the pulse and we know that things should have changed, then there's something not going on. So it's a we have our little secret ways of finding out, but no one's getting
Dang.
told off. That's the important thing. No one's getting told off, and our job is to work with the best that someone can do,
Yeah.
And so if that's
Meet
a
them where they are.
100%, which is exactly where I was going next with what I was saying. So with Japanese acupuncture, we meet you where you are in terms of your hara diagnosis. With your pulses, we feel your pulses and we feel where your organs are at and which ones need the most love. So we're meeting your body where it's at in the moment and treating what we meet effectively. So that's the probably what I want to be the take home of this talk is that we're here for your body. We're here for you. We're here for every aspect of your body. It's not just about, oh, we want to clear this pain. It goes way deeper than that. And because often pain has a huge psycho-emotional aspect to it as well. So we need to be dealing with that. And our goal is to create the safest space possible that you feel that you can talk about those things and that we can go to that space from a Chinese medical point of view, emotions and thoughts and feelings and anything outside of the physical body makes up a huge aspect of Chinese medicine. So for us, if that aspect isn't dealt with, then things aren't going to move. So to be able to go there and to be able to address those symptoms at the same time. That could be premenstrually flaring with your mood. It could be that. It could just be even that. And some women don't want to admit that they feel like they're a crazy person premenstrually, and they hang on to that, but we can feel it in their pulse, and we're like, I'm feeling that this could be an issue for you, and it might take a few weeks, and then they then said, yeah, I'm not coping. And then we're like, great, good, okay. So that onion layer is opened and we're able to go in further. So it's um it's a good it's a good thing when someone feels safe enough to release and open up on the table. And I
Talking
so
of, I was going to say
yep,
there's a question here in relation to being on the table, so that
yep,
ties in this
great. Yeah,
beautifully.
yeah,
So this one's come in. What do you do to help completely switch off while having acupuncture to stop the fight in your body, like to keep you alert?
yep,
Stay in that flight or fight instead of just allowing the body to rest
yep.
and digest. I love
Yep.
this. That's a good
It
question.
is a great it's a great question, and kind of the one of the $5 million questions, I suppose. It's is the question relating to the person on the table or what the practitioner
I
does
think
for
the person on the
patients?
page, yeah, or
Person on the
maybe
table.
both.
Yeah,
Maybe what
I
the,
can answer both. I can
yeah,
answer both.
yeah,
So
yeah.
well, for the first session, everyone's people involved trying to figure out what's going on there and how that in the as of the second, third, and the treatments that are coming after that. You kind of know what you're in for, so you know what's going to happen. Um, Hopefully the practitioner and patient build a strong rapport so that they can be open and honest, and where our job is to allow maximum relaxation for the person on the table, which is really interesting and great why we have headphones, because the music that we have, I suppose you could say, well, it's calming music effectively. It can be flutes, it can be rainforest music, it can be lots of things. Effectively, we're hooked up to Spotify. So a colleague of mine asked someone who hadn't been able to relax on the table, and she posed the question. She said, "What do you think might need to happen so that you can fall asleep on the table?" And those questions are really powerful because it's not about what we think. It's exactly what you or the patient thinks. And so the patient said, it'd be to listen to, I don't know which band it was, but the furthest thing I could think of to put me into a state of relaxation. And so she played that music and then came back in and she said, "How was that?" She's like, "I was asleep the entire time." So whatever the person needs to be able to attain that state is what is our job. So for some people, it could be, can I have an extra pillow under my knees? For some people, it could be, can I have the heat lamp on my feet, not on my tummy? It could be any, we don't, who knows what it is, but it's a lot of people like to be lying in the position that they sleep in. So that can be done as well. Obviously needles permitting, but that's a common thing to do, especially if a woman's pregnant. And then lying on the side is generally how they're treated, and it can often be the side that they sleep on, not the other side. And I know there can be some conjecture there in terms of lying on which side you need to. Um, at the end of the day, it's for 20 minutes, and from our perspective, we see it as if it allows them to get to a deep state of relaxation, and if it allows their body to regulate and to do what it's need to do so that their body's happy, then we're allowing that. So that's a good question though, and it's different for everyone. Different for everyone. Hopefully that answers that question.
I think it does. I think it
Wonderful.
does. That's for sure.
Wonderful.
There is another question here, and I
Shoot.
didn't even know there was such a thing, but
Mm.
what's the difference between electroacupuncture and manual acupuncture?
Ah,
Is
good
there a
question.
machine that
Yeah.
does acupuncture?
Yeah. Well, yes and no. It's um
Hold
obviously
on a second. What? How? Oh, okay. I'll let you explain. Sorry.
No, no, it's fair enough because if you've not had acupuncture, that sounds like a really weird thing. And to think that a machine does it, yes, fair enough. But AI is not going to take over our job because they can't put needles in. This is where my stance, and I'm sticking to it. Um, Electroacupuncture, what it is it's a little box. Sorry, my hands are up here. It's a little box, and it generates a current. And so you put needles. It's incredible for pain. Um, so if you think about that creek analogy I was talking about, that's full of dirt. And if that dirt is pain, think of if someone has calf muscle pain, and they will generally run down an acupuncture channel, the pain will. And so we would then put a needle above and below that painful spot, and then you would turn the machine on. So it's a very gentle, and it's only, you slowly turn up the intensity of the electricity current to the person's tolerance. So you're not starting at 10, you're starting at 0 and you're working up. And so there's intensity and there's frequency. So frequency is obviously how quickly it's beating. Intensity is the intensity of the current. And so when you put that on above and below a painful spot in the calf, it's literally blowing the blockage out of the acupuncture channel. So it's literally would be putting water down a creek that's full of dirt, and you're literally picking up the dirt and you're getting rid of it. A clear creek is a no pain creek. A clear channel is a no pain channel. So
So
whereas
is
a
it
needle,
electrical pulses? Sorry, like
yeah.
tens machiney type
Correct. Exactly.
pulses?
Yes.
Yeah.
Yes.
Okay.
Sorry, I always forget to explain it to a tens. It's pretty much exactly like a tens machine. So if you were to put a pad, if you've got the tens machine with pads, if you were to put a pad above the pane and a pad below the pane, thing about pads is they're larger, so you can't, they're not specific, they're more area, they're not pinpoint, so that you won't be, it won't have as much of an effect. But when you're looking at pain, for instance, in the abdominal region where it's a general pain, TENS machines are fantastic because they're covering a large area. Um, but in terms of the question that was asked, so the electroacupuncture is attached to the needle above and below the pain, and then it would pump the current through the channel, whereas the needles, you put the needles in, and some people like to move the needles on it because it can stimulate the acupuncture point more. And that will have a more gentle approach to clearing the pain, but still incredibly effective. It depends on the skill of the practitioner and what makes sense to them and what the patient needs. So, a lot of women can have TENS machines or electroacupuncture in effort to try and ovulate. So if there's blocked blood that is sitting in the organs of the pelvic cavity, and the TENS machine is able to help move that blood. So you can still do manual, you can put the needle in, and that still works just as well, or you can put TENS machine in. So there's a specific protocol for women that aren't ovulating. It's common in polycystic ovarian syndrome. And so it is designed to specifically help the body ovulate, and you use that every day, and you can take it home. And yes, there's quite a lot of women that do that as well. So that's the main difference. But yeah, it's a good question because the thought of attaching electrodes to a needle can cannot sit well with some people. So to explain it is good. So whoever asked that question, thank you. That's a good question.
Awesome. Now we have another Chinese herbal
Right.
medicine question.
Yep.
So, oh, in Japan, you can get wraps and capsules for Chinese herbal medicine.
Mhm.
Can you get them in Australia?
Was that wraps and capsules?
Yeah.
Yes. So wraps, I'm not 100% sure what they mean by wraps, but capsules, absolutely. So you can get pills, you can get capsules, and then you've got granulated herbs and powdered herbs, and then you've got raw herbs. So the capsules have the powdered herbs in them. Um, it's kind the pills versus pills and powders, or sorry, pills and capsules versus powders and granules and the raw herbs. So the raw herbs are the ones that you have to take home and you cook up and for an hour and they can stink the house out, but they're incredibly effective. So it's a trade-off between effectiveness and convenience. So it just does this thing the whole time. So the most convenient, which is these little pills, they're the ones that are the least potent out of all of them. But there's no taste. They're little hard pressed pills and they're super easy to take. And so there's no issues with taking them at all. Um, Really convenient, not as effective, but still work really well. So for some people, and actually quite a lot of people, they do work quite well. You just have to take a high dose to be able to get them to do the same thing. The capsules are great. They would require you to take them. You take four of them twice a day. So they're kind of like Panadol size. So you take four of those twice a day. Whereas these little black pills I was talking about there, you probably can't see, but they're kind of like a ball, like a little ball bearing size. So you'll have to take 10 of them twice a day. Um, so low potency, so you have to take more of them to get the job done. Whereas the capsules, you take less of them because they actually have the powders in them. You go up to the other end where the powders you make up like instant coffee, the herbs you boil and you cook, and the convenience is not as high. However, their potency is 100%. And if someone's taking, we have powders, and if someone's taking powders or they're taking raw herbs, we expect change pretty quick because we know how effective they are. So, yes, but I'm intrigued about wraps. I need to look further into that. I don't know what they mean, but they're
I
Japanese.
wonder, um, the person who commented about the wraps, if you want
Mhm.
to chuck in another comment, just to let us know a little bit more, because there might be something called maybe different or something.
Yeah, there's the herbal medicine in Japan. This is just from my understanding. I could be wrong, and please correct me if I'm wrong. It's called Kampo. So it's a whole different style. I'd say different style. I don't know much about it. All I know is that a lot of people ask me if I do it because I do Japanese acupuncture, but they aren't a package deal. So it's a whole different learning. Like you need to study Chinese herbs, you need to study Japanese herbs as well. I assume they make them up the same. So wraps could be a specific way of having the herbs within Japanese acupuncture, sorry, Japanese herbal medicine. I just don't know a lot about it. I'm sorry. So and it's something. It's kind of like a lot of Japanese Chinese acupuncturists don't know what Japanese acupuncture is. We again don't.
There,
We again
there.
don't
It's
know what
a
Japanese
bit
acupuncture
like a
is.
general surgeon isn't really going to go,
Correct.
look what
Yeah.
gynecological,
Yeah.
gynaes do. So that's a
Exactly.
fair,
Yeah. Yeah.
that's a
And
fair thing.
yeah.
Oh, the wraps are like gelatin sheets.
Oh, yeah. Right. Okay.
There's a little bit of info there for you.
Yeah.
Have a little look.
I've got
Um,
um I've got a lot of herb nerds in my world, so I wonder if any of them know about these gelatin wraps. I'm intrigued
Her
now. I really
herb
am.
nerds. I love it. That sounds
Yeah.
good. All right, so we've got a few more minutes. Dr. Ash, is there anything else you want to cover off for the night?
No, I think with what I said before about effectively treating when we're meeting the body where it's at and the it's not so much about acupuncture and China's herbal medicine. We're not in the game of treating anything. We don't treat, we don't fix. That's ingrained in us. We are helping the body do what it knows how to do. So yes, that's managing a scenario. We don't do labels as well. We really don't like labels. We like addressing symptoms and seeing how the body wants to do that and following the path of what the body wants to do. So we're creating a space that you feel or the patient feels comfortable enough to enter into a space of deep regulation. And by following the treatment plan, which would be as many acupuncture sessions or frequency as the practitioner feels that you need, along with the herbal medicine as well. And when you take the herbs, you're effectively getting the same therapeutic benefit as if you were to have an acupuncture session. So you're doing it twice a day, which is why we expect a fair rate of change. And so when you have the herbs twice a day, you're getting two acupuncture sessions a day, plus you're coming in and reinvigorating momentum every time you come in to have the acupuncture. And so by doing that, we expect a lot, and often there's some good changes pretty quickly. So the when someone comes in, we expect good things.
So what I'm hearing is consistency is key.
Consistency is absolutely key, and that it's really great when people are consistent and they see the benefits, and we get to see their body changing through these states, and then things that they come in become things of the past, and so it's whether that's managing pain flares, whether that's sleeping better, whether that's someone's coming in for gut health and they're not reacting to things anymore, or maybe they're just not reacting. They were reacting at 10 out of 10 and now they're reacting at a 3 out of 10 and they're like, this is way more manageable and I'm wrapped. So it's also about the expectation of what the patient thinks rather than our expectations. We're going to get out of the way. Our job is to get out of the way and be there for the person and what they're wanting to get out of the treatments. So it's 100% the person is in charge who's on the table, and we're just there to do what we know to get the body to the optimal space that they need to feel great.
I think you've answered too, like for so many endo people, we get to the point where it's like, I don't trust my
Oh,
body. Like, I
absolutely.
don't trust that
Yeah.
it's going to do this because you've been let down by medications, by surgeons, like all this stuff. So, like, hearing you say, you're going to meet them where they're at, like, it's just, if you had those reservations, it's really like, okay, let your practitioner know so then they can
Yes.
help work through that
Yeah.
too.
Yeah, exactly. No one's a mind reader, and when as the body is changing, things will surface.
Mm,
Thoughts will surface, feelings will surface. And there can be new issues that surface as well as the body is unwinding and unraveling from the space that it's in. And if it's taken a long time to get there, there's lots of layers that it needs to go through. And so as the new layer turns up, more things will turn up, and the more things that turn up, there's more things we get to do, we get to address. So it's great watching the body do that, and to have someone that comes in who was so fixated, as I said before, whether it's pain or taking a day off work, or not being able to ride their bike to work, and then they can do that, and they might come in for that, and they go, oh, while we're at it, then maybe they're like, I don't know, excuse what I'm talking about. I've been constipated for months. I'm like, great. Okay. Do you want to work on that? No. Oh, please, can we? Yeah, absolutely, we can. So that's if it's not regulated by the time their knee pain's gone. So
yeah.
it
Yeah.
just depends. But yeah, whatever the body is saying, that's what we're addressing.
Yeah. That's so good. So I think we might wrap it up there.
Right?
Um,
Good.
that is just absolutely when we always have these sessions, I always leave like there's always so much to learn.
Yep.
And I'm going, okay, this is really cool. I've learned something new. I can go out and help support other people, but
Mm,
also knowing a little bit more in the difference between the different treatments, between
absolutely. Yeah.
the importance of it as well, and making sure you actually take what your practitioner tells you to take because it is
Yes.
supposed to help.
Yeah, I didn't touch on the money thing you said before, and my boss said the other day, she's like, these people that don't take their herbs, they must be loaded. Like they're literally just paying for these herbs and they're just sitting there. They're like, where are they getting all this money from? Like it's just, I'm like, I never thought of that, but yeah,
Yep.
following the treatment plan is key, same as consistency.
Yeah, absolutely. It's so good. Dr. Ash, thank you so much for jumping
Thank
online
you.
and joining us
Thanks,
tonight.
Ash. Thank you,
Special
Kendo.
thanks and special call out to our volunteer Emily, who had made this connection and said, "Hey guys, you really
Yeah,
need to get Ash to do a session." So thank you, Em. Appreciate the joining of the dots for us. And if you're wanting to watch it back, we're going to make this video as a part of our Managendo series. So if you're listening tonight and go, oh, I really need to send this video to a friend, we will share the link in the coming weeks for that. But thank you, Dr. Ash, again
Thank you so
so
much.
much. What a great way to finish off my Thursday night. And great. Thank you everyone for coming online. And everyone, I hope you have a great night.
Thanks, guys. Really appreciate
Thanks,
it.
guys. Bye.